Next, we present the methods of blood extraction via capillary puncture of the finger and venous puncture recommended for those over 1 year old. You will need the following material in order to collect the samples: triangular point lance, filter paper, gauze, alcohol, bandage for puncture zone, resealable plastic storage bag, syringe and needles, fridge, complete with legible handwriting, the form attached to the sample. It is very important to follow the instructions in detail in order to collect a valid sample. The recommended steps for blood extraction via capillary puncture of the finger are: clean puncture zone with alcohol, dry excess alcohol with sterile gauze, puncture the finger, dry and remove with sterile gauze the first drop of blood that is formed. Allow a voluminous drop of blood to form, slightly compressing the tissue around the puncture zone. Allow the drop of blood to touch slightly the filter paper and to spread on it. Repeat the procedure to fill the necessary number of unfilled circles. Do not overfill the paper by applying more than 1 drop of blood per circle. Ensure that the drop of blood absorbs uniformly onto the filter paper and that it appears on side opposite from where the drop was applied. When performing blood extraction via venous puncture, these are the recommended steps. Clean the puncture zone with alcohol. Extract 0.5 to 1 milliliter of blood from the vein. Discard the needle carefully and put the point of the syringe near to almost touch the filter paper in the center of the circles and to allow the blood to impregnate the paper slowly without damaging it. Repeat the procedure to fill in the necessary number of unfilled circles. Do not overfill the paper by applying more than 1 drop of blood per circle. Ensure that the drop of blood absorbs uniformly onto the filter paper and that it appears on the side opposite from where the drop was applied. Once the circles are absorbed with blood, put the paper on a clean, smooth, straight, flat, and non-absorbent surface such as a laminated, plastic, or metal table, as well as a bracket to support the filter paper, and let the blood dry until the following day at room temperature. After correctly drying the filter paper, put it in a plastic zipper-sealed bag in the fridge at 4 degrees centigrade for storage until it is sent to the laboratory for analysis. Now you can go back to main screen to select the option of your interest or to obtain information about the method of blood extraction via capillary puncture recommended for patients under 1 year. If you want to know an alternative to the method of direct impregnation of filter paper, we recommend to review the deferred method of extraction via venous puncture.